So today, welcome to Health Council Talks. Today we're going to be joined by Molina and Sharon Nota, who will let us know all about their services, turquoise care, all of those great things. I'll get us started with our land acknowledgement. The New Mexico Alliance of Health Councils gives sincere gratitude for the opportunity to live and work here on ancestral and unceded lands that have been cared for by our state's original peoples of the Apache Nations, Pueblos, and the Navajo Nation. Together, we honor and respect the indigenous cultures, traditions, languages, and the rich contributions that continue to shape New Mexico. We acknowledge the history and impact of genocide, dispossession, colonization, and ongoing systemic inequities to Indigenous communities. As a collective, we commit ourselves to working toward justice and reconciliation, dismantling inequitable systems, standing in solidarity with and respecting relationships with Indigenous peoples. The Alliance affirms Indigenous sovereignty and self-determination and self-governance of New Mexico's tribes, pueblos, and nations. In offering this land acknowledgement, we encourage you all to reflect on your own relationships to the traditional lands and take concrete actions to dismantle systems of oppression where Indigenous peoples are empowered and celebrated. All right, so I will hand it over to Valeria for a quick advocacy update.
Beautiful. Welcome, everybody. Happy Friday. Sam, do you want to do a screen share of our deck so people have a little visual? So great to see all of you. We're 28 strong here at Health Council Talks. All right, team. As you know, we are in the latter part of the interim session. In the Alliance, we've been meeting, of course, continue to do our advocacy work, engaging with elected officials, legislators, senators, representatives, the executive branch, educating them on the meaningful, impactful work that health councils lead at the local and systems level, because you all collaborate with multi-sector partners, right, in service of communities. And so this is a great opportunity these next 2 months, November, December, to reach out to your district's representative and senator and talk about the great work that you're leading, share impact stories, the things that you've learned, the areas of, opportunities for collaborating with various partners. This is such a great time to continue to educate our elected officials, right, on who health councils are, your function, your impactful work. All of this that we do together, it's a unified effort in advocacy. So as we go into the legislative session, we've got more enlistment, right, across our legislators who are decision makers with ensuring, funding for critical functions of public health. Health councils are one of those many priorities. So we invite you to join us in that effort. And just so that you all know what's happening here in the interim session, the Legislative Finance Committee is going to be meeting the week of the 17th. These are great committees to join and stay informed as how the state of New Mexico is prioritizing funding going into the next year. So we invite you to stay informed. Sam has included the link and also contact information, because these members who are part of Legislative Finance Committee are also most likely part of your legislative district. And so you may already have relationships with them. There might be some that you don't. So it's another great way to see who you're connected with and who remains to be engaged with and share the good work that you're leading. So that's available for you. If we move to the next slide, Sam. And then some other timely updates along the lines of advocacy. One of the things that the Alliance leads is year-round public awareness marketing campaign and outreach. And how do we do that? We do that through our radio show, To Your Health. So if you haven't been featured on your Alliance radio show through Hutton Broadcasting, we invite you to schedule time with me. It's recorded via Zoom. Many of you, a lot of you have been featured, so it's very conversational, really fun, and you get to talk about the good work that you're leading and your success stories. And then, of course, testimonials are key in our advocacy efforts. So from your Health Council membership, maybe one of your partners can submit a testimonial written or video, or community members that have been deeply supported by the work that you are leading. How many of you have been here with the Alliance on the radio show To Your Health, maybe Digital Hands? I do see some of you here. Shay, you want to talk a little bit about that, your experience?
Sure. I was actually super nervous before I did it. But it was great to just visit and talk with Valeria. And it was just kind of like two friends sitting and talking about great things. And I think it was a great success. I've shared it through our whole community, and they're very impressed with it. And it was a great chance to let Santa Fe know and everyone else, including our legislators, what hard work our health councils are doing.
Thank you, Shay. Again, storytelling is so powerful as an educational avenue, right, to enlist support from our legislators. So thank you, Shay, and you're welcome back anytime. And to all health councils here, please email me. Sam's going to put my email in the chat. It takes about an hour and 15 minutes, very conversational. You get to tell me. These are the things I want to talk about when it comes to our health council. And the great thing is that once the radio show is aired, and it's also live streamed, so it's accessible everywhere, we can download the MP4, and then you can utilize it for your own outreach, your own marketing and communications. And we use it as well when it comes to our advocacy outreach with legislators as another educational tool. So that's an open invitation to all health councils. And then, um, given that, so we've launched the statewide meeting. It's the annual convening in support of county and tribal health councils for 2026. We've been meeting on Tuesdays. This last Tuesday was election day, so we ended up canceling those meetings for both statewide meeting and public health day planning, just to make sure people have the flexibility and freedom to go vote, get out and vote. Next Tuesday is going to be Veterans Day. I'm sure a lot of your offices, a lot of you are closed for the day. So we're going to reconvene on all event planning for next year, right? Statewide meeting, public health day, planning meetings, Tuesday, November 18th. So we look forward to seeing you on Tuesday, November 18th, same time, same channel. Um, any questions, my friends? I know that information is a little bit more relevant to health councils, but all right, seeing none for now. Over to you, Sam.
Okay, thank you. Thank you, Val. So just a quick reminder, thank you to everybody who attended our advocacy training session that we held on Wednesday with Carter and Talia. You'll see the recording and summary of all that coming out on Monday with the Health Council Talk email and in the Mighty Networks Hub. And then next Friday, we have federal grant and fundraising, which will be hosted by Joseph here. Have a lot of great information, tips, can be there to answer your questions. That link will also be in both those places I mentioned. So we hope that you'll join us. It'll be from 10 to 12. Okay, and with no further delay, again, welcome to our presenter today from Molina Healthcare, Sharon Nota, who is the program manager, who also serves as Molina's first tribal liaison. She has a lot of experience in managed care, quality, cultural competency. So we are thrilled to have her with us today. So I will pass it over to you.
Good morning, everybody. It's good to see some friendly faces. And thank you for having me today. I really appreciate it. And thank you to the New Mexico Alliance of Health Councils You all have been so gracious to me and to Molina in general, and we appreciate the collaboration as always. And just a shout out to Geraldine. I know that she's probably on here, but she's been part of a lot of work groups that we've been a part of. And also Valeria, thank you so much for your support. We really appreciate you. And I am here for Molina, representing our Office of Native American Affairs. And I also have my director, Sherilyn Roanhorse Aguilar. I think she's on the call as well. So, so the both of us are available to represent Molina today. So thank you for having us. And happy Native American Heritage Month to all of you all. My name again is Sharon Nota, and I'm Navajo or Dene, originally from Arizona. So Yate to all of our tribal health council members, and She'e Sharon Notayan Shea Todachitni Shlondo Tachitni Bashichin. I just said that my clans are Bitterwater people born for the red running into the water people. And my Nulla, who is my paternal grandfather, is from the Cloge clan. And also my grandfather on my mother's side, he is Totocoche. So he's from the Sheep Springs area. So I have a lot of relatives in Arizona and New Mexico. So that is just a little bit about who I am. And I've met a lot of the Health Alliance representatives throughout my years here within the managed care space. So I just want to say that I've always very cherished my relationship with them and collaboration. So I'm very glad to be here on behalf of Molina Healthcare to share a little bit about what we do and some of the important programs that we have to offer that you all may find useful as resources for your work. And so today's agenda is just a little bit about who Molina Healthcare of New Mexico is. And as you know, we were in the centennial care realm for quite a long time. And I worked for when I first moved to New Mexico, I started with Cimarron Health Plan, which probably ages me because that was a very long time ago in the late 90s. And Molina Healthcare had bought Cimarron Health Plan. So my work transitioned over to Molina. And I previously worked with Molina for 18 plus years in the behavioral health and quality realm. And I was, like Sam had mentioned, I was one of the first tribal liaisons that was appointed for the managed care organizations for Centennial Care. So I did that work along with my other duties as assigned. But after Molina, I worked a little bit with United Healthcare and also Western Sky Community Care. And then now I'm back with Molina as of August. So I'm very glad to be back full circle. As you know, our lives kind of go in a circular pattern. So that is very much true. And so I'm very glad to be here to share this information with you. We will also talk about our value-added services and some of our care coordination programs or the care coordination program so that you can get an idea of how important that is to work with your communities and who are on Medicaid. And I'll also share some Molina resources and also take a really quick snapshot of our outreach efforts in the rural communities as well as our Native American communities. And then I'll give you some information about who our Turquoise Care members are with Molina. And then we'll take some, I think I inserted an updated slide on our Native American Advisory Board. And then we'll close out with questions at the end. So just for some information, I know a lot of you know a little bit about Molina Healthcare already, but our New Mexico-based health plan has been serving New Mexico under the Turquoise Care program since July of last year. And we really look at recognizing ourselves and celebrating our approach to our members who are very culturally diverse throughout the state of New Mexico. And we also work with our provider community, including our Indian Health Service, Tribal 638, and Urban Healthcare Program. So our mission really is to improve the health and lives of our members by delivering high quality healthcare. And our value statement is really to distinguish ourselves as the low cost, most effective and reliable health plan delivering government sponsored care. As you know, we provide Medicaid, and we are in the marketplace realm, and also Medicare. So those are government sponsored programs that we take pride in serving. Our values include integrity, of course, and also accountability and teamwork, and honest and open communication with our partners. And we really look at the member, and we focus on communities. And with Molina, we have over 40 years of Medicaid experience and expertise to support our members in a variety of opportunities like behavioral health and long-term care services. And we also provide a network of quality doctors, along with extra benefits and dedicated member service approaches. Okay, so we're going to talk a little bit about our value-added services and care coordination. If you don't know already, all of the Turquoise Care managed care programs, they all provide the basic Medicaid services or benefits to our members. And with Turquoise Care, we work collaboratively with the other managed care organizations. That includes Blue Cross Blue Shield, Presbyterian, and United Healthcare. And we work collaboratively as 4 MCOs to provide those basic Medicaid services. But what sets us apart is really what we call our value-added services. These are additional benefits that are available to our members. And even though this graphic looks a little bit small, I will go ahead and send the original flyers out after the presentation, and Sam can distribute it to the members of the council. So we can just kind of go over it real briefly today. But our value-added services include extra benefits that our members on Medicaid can benefit from. And these are available to meet the unique and complex and unmet needs of our members. A lot of times we get questions about housing assistance, for example, and we do have that as an additional benefit that we can provide. And a lot of these value-added services go, the requests go through our care coordination program, and members have to complete a health risk assessment. And from there, their care coordinator can assist with getting these extra benefits administered to them through a request form. And some of the things that we offer are extra benefits to our pregnant moms and the babies. We do offer car seats and extra incentives like travel crib or stroller. You can choose one of those items for your baby. And we also have, we've had in the past virtual baby showers that our members who are pregnant can take advantage of if they're in other parts of the state. And I know for the coming year, they're looking at having more in-person virtual or in-person baby shower events. So that's in the planning. We also offer homemade meals for our moms, and these are sent to the moms at their home. And these are for our pregnant moms. And we also offer enhanced dental, and that's for support or services that are outside of the Medicare or Medicaid covered benefit. We also have housing assistance, and these are, for example, for home goods, assistance with mortgage or rent, and other items related to the home. And we also have an enhanced transportation benefit that helps pay for medical and non-medical transportation that Medicaid does not cover. And we also have activity bucks, and this is a great program for families who are looking for ways to assist with, for example, getting our kiddos into sports programs. Maybe they need new equipment, shoes, or help pay for after school care or some things like that. Those are available through activity bucks. And then we also have our traditional healing services. And right now, this year for 2025, members can get up to $300 per year for therapeutic massage, acupuncture, curanderismo, and other traditional ceremonies and services. For Native Americans, that includes assistance for the items that are needed to complete their ceremonial process. And so that's offered on an annual basis. And then we also have a value-added service program for workforce and educational development. And this is a supplemental service to support our members for opportunities like, for example, GED, if they need other payments that they need to do for their professional development, etc. So these are our value-added services that we have available for 2025. And there'll be some slight changes for 2026, and that will be some information that we will share in the future next year. For our care coordination program, this is a very important program because it helps our members to complete assessments to see how their health is doing. And it helps us to really identify those individuals who have more complex conditions and need more assistance and services. So when an individual gets into care coordination, the health risk assessment is completed. And this is a standardized questionnaire that is used to obtain basic health and demographic information about the member, to see where the member's at with their care. And also it identifies the need for a comprehensive needs assessment, which is the next step if they need that. And this is just something that is done in the member's home within 30 days of an HRA completion. And this helps to work with those complex needs that the member may have, maybe their diabetes care, or if they have other conditions that are in need of attention, the care coordinators will work diligently with the member on those conditions. And we also have a comprehensive care plan that is created based on the member's needs that are identified during the assessment process. And these needs are met with the member, and if they have a caregiver or whatnot, the care coordination team really works closely with the member and their families. And they also work with the providers as well to support the comprehensive care team. And they work on such things as medical or physical health needs, behavioral health needs, whether or not the members' prescriptions need to be addressed, if they need medical equipment and long-term care services and supports, and other value-added services that I mentioned in the previous slide. So the care coordination piece is really important for our members, and we want to ensure that our members have a member-centric approach to their care. So that's what the care coordinators do on a regular basis. And they also have access to available resources to help support the members with their social determinants of health needs, maybe their housing situation or whatnot. Those are identified through the care team as well. And so this is really like I said, a person-centered approach that we have with our care coordination team and our members. And we also have very strong ties with their community-based resources. So that's very important as well, so that they can get the care that they need, the resources in their community, etc. So next slide. And this is just a phone number that you can write down or jot down. And I think the slides will be shared with you after, but this is how you can reach out to our care coordination teams. You can do phone or fax, and the care coordination queue is available during regular business hours, Monday through Friday, 8 a.m. to 5 p.m. Mountain Standard Time. And also members, you can also refer members to the toll-free member service line. Okay, so I put in this slide for our telehealth programs. I heard at a meeting recently that telehealth programs have gone away, but not for us, for Molina Healthcare. These are very important programs for us, because these programs really help to establish a way where our members can access care from where they live. And a lot of times, as you know, I don't know if any of you all have taken advantage of telehealth programs, but they're very convenient, and you just can call or go on a website or whatnot and connect with a provider. This really can help to address challenges that members may face if they have access issues to get to their physical or behavioral health providers. And we also promote this as an equitable opportunity for not only our Native American members, but all our members to access a lot of these wonderful programs. And I apologize for the graphic, it's very small, but like I said, I will share the actual flyer with you all, so you can have that available as a resource in your communities. But some of the wonderful programs that we have for telehealth services include Brave Health. And what Brave Health does is they're really focused on improving health, behavioral health, with our members. And it's a great opportunity to get medication management through this program, and support groups via video conferencing. And it really enables our providers to refer patients or members who are needing urgent behavioral health support. So this is a great program called Brave Health. We also have Teladoc, which is a 24/7 virtual healthcare program. And this is for non-emergency conditions. And it's done via phone or video conference on your phone. And it's a great opportunity for our members to access services through our mobile home devices, and helps to support any of their needs if they're not able to get physically to a doctor. So this is the teledoc program. And next slide. These are so small, I apologize. I need my glasses to read them. But we also have UMA, which is a virtual care program for members who are expecting a child. And it's a new program that we've had in place, and it helps with access to a provider. And it's really an opportunity for our pregnant moms to get some additional support, and including lactation support, and getting to a lactation specialist, a behavioral health therapist, and so forth. So this is available for our pregnant moms, and we work closely with the provider networks as well through the UMA program. We also have New Mexico Help Finder, which I think a lot of you on the call may know of. And this is a resource that we can look up support or additional information about programs that are available within our areas. And I've used this myself for my brother who is disabled, and I've punched in his zip code and gotten some valuable resources when I needed, including like assistance for his housing, and also assistance for food and transportation, etc. And so this is something that you can use wherever you're at, or if you are facing an individual who needs some extra help with food, for example, food insecurity, you can type in your zip code or the member zip code, and just it'll come up with some valuable information that you can share with the member on the spot, or send it to their email if they have one, etc. It's a great program. We also have there's the Galileo program, we have 28 Health, we have a DentaQuest teledentistry program. So those are all available as well as telehealth programs. So I'll send the flyers so you can learn more about these and see how they can be of assistance to you when you're out in the community. Okay, we'll go in next to Molina Resources. And our website is www.molinahealthcare.com. And on here, you can access information about benefits and services, and some helpful forms. And members can actually register for the member portal. And you can do find a provider search as well. And you can request to receive virtual care. You can access the Help Finder tool here, and much more. And for our providers out in the community, you can get information from our website on the appeal and grievance information, online directories, clinical care practice guidelines, and provider manuals. They can also register for the provider portal. And if you register for the provider portal, you can get access to a lot of information, including information on your patients that are assigned to you if you are a provider. And that's a very valuable tool as well. We also have a site hub that you can access and get information about prior authorizations, pharmacy, HIPAA, fraud, waste, and abuse, forms, and other newsletters and education, including member rights and responsibilities, and who to contact within Molina Healthcare for additional information. And now we'll go into our outreach efforts, which includes, like I said, rural communities, and also Native American communities, and everything within the state of New Mexico that we do outreach for. Some of our member and engagement activities that that we've been doing a lot with this year and last year was really looking at reaching out to our tribal communities and communities throughout New Mexico. We do a lot of health fairs. We do a lot of wellness activities, for example, with the Navajo Nation and other IHS service units. We are involved with their wellness walks, like the Just Move It and the Pueblo Crossroads. And we also do wonderful things like our backpack distributions. And we're involved in a lot of our Elder Day events. And one of the things that we also do is we have a special relationship with Santa Fe Indian School, and we provide scholarships to the students who are in the Health Careers program. And we celebrate them every year, those individuals or those students that do get the scholarship. And what the scholarship is really geared towards is giving them some educational monies, I guess you could say, to help support their careers beyond high school. In particular, those we're hoping to improve or increase their involvement in community health worker certification. And so we want them to go beyond high school and really enhance the workforce by going into health careers. And so that's the goal of this collaboration with Santa Fe Indian School. So we go to their parent orientation, and we also participated recently in their feast day event, which was open to the community. So it was a wonderful event, and we look forward to working with Santa Fe Indian School and the Department of Health Office of Community Health Worker more in the future to enhance our scholarship program so that we can work collaboratively to really support our students in health careers. And we also participate in food distribution programs and other events throughout the state. So that's what we do for outreach. And I want to share also information for those of you who are in the Gallup area or McKinley County. We do have a Molina Help Center in the Rio West Mall. And this is a center that you can go to access information. They get a lot of members and non-members, just community members coming in and asking questions about Medicaid, Medicare, et cetera. And a lot of times I've worked in the help center to assist as well. And we get a lot of questions about Medicare, the dual eligible population, and the Medicaid program access, for example, how to access value added services, benefits. And the staff there are very knowledgeable, and it's a great opportunity for members to come in and just get more information about insurance coverage. And the staff there are PE determiners, so they're available to assist members with with their insurance applications, etc. And they also we have staff there that speak Navajo, and we have one staff member that speaks Zuni. So that this is an opportunity for our members and community members in the McKinley County area to really access in-person care or access to care. So it's a very valuable resource for us to have available to you all. And we're looking at opportunities to open up more help centers as well. So stay tuned for that. And some of the past events that we've had in the springtime at throughout the state and at the Gallup Help Center, they have, the staff there have coordinated baby what am I saying, baby showers, like April showers, bring May flowers events, and it is like a baby shower where we give out diaper bags and other resources for new moms. We had some new moms come in to get information, and they were entered into a drawing to receive some wonderful prizes for their baby. And so it was a great event that happens at the Help Center. And we saw the cutest kids and babies in cradle boards. And it just really makes you appreciate the kind of work that our programs really provide to the communities that really need the help. So that's something that's near and dear to our goals within our tribal affairs, and also within Molina in general, is to help our communities. We also have at the Gallup Help Center monthly birthday celebrations. And what the staff does at that time is they celebrate people who have birthdays within the month, and they have a cake and everything. And it's a way of sharing, and it's a way of giving out more information to the families, etc. So it's a wonderful event. And we've participated too in working with our tribal liaison in the San Juan County area in Shiprock and etc. And we've helped her to coordinate her celebration of motherhood event there in collaboration with the Office of the Youth. And that was also a great opportunity to reach out to new moms and the young kids, etc. And we try to incorporate addressing preventive health care during these events. When we can, we provide opportunities for providers to come in and do immunizations. We are trying to work with our mobile healthcare providers to do immunizations and well child checks, etc. So we're really focusing on not only assistance with basic needs, but we're also trying to promote improving preventive health care within our communities that we address with these events. Okay, next slide. And this is an example of how Molina responded to some of our emergency responses for the fires and the flooding, etc. We were out there, the growth and engagement team were out there. They were helping, they were providing hygiene kits, they were providing food boxes, etc. So we're really out there stressing community, and we're really out there to really try our best to help out when the need occurs throughout our state. So that's one thing that Molina really really is involved in, and we really believe that, you know, we're all community. Wherever we're located, we all come together to help each other out. Okay, this is our community and our growth and community engagement territory map. And this is where we have staff throughout the state that are assigned to reach out to the different areas. So if you are in any of these areas, you can see who to contact for your growth and community engagement representation. We do have some empty slots here. So if you live in those areas where we don't have a growth and community engagement individual listed, you can always reach out to Wendy Santiesteban. She's our director for the growth and community engagement team. And her direct line is on the top of the screen there. Okay, so next we're going to kind of slide into our getting a snapshot of Molina Healthcare's turquoise members. Right now, as of 10/26, we have 37,774 total membership, and that is continuing to increase. And so we're providing more and more care to a lot more people out in New Mexico. And these are just some of the snippets of who makes up our Medicaid population. And also the gender breakdown, the age breakdown, and as you can see in the far lower right-hand corner, that will give you a snippet of our pediatric age categories. And as you can see, we have a lot of kids covered under Molina Healthcare. The next slide is showing you where we are in the state according to our membership. So those little bubbles there kind of represent where our members are located. As you can see, the biggest bubbles are here in Albuquerque area, and then Las Cruces. And then we have these other bubbles up here in different areas of the state, including Santa Fe. And then we have on the eastern side of New Mexico, we have a lot of membership out there. And then, of course, the northwest quadrant of the state. And that's the bubble in Gallup is our membership in McKinley County. And that's who primarily is targeted for Gallup Health Center. We also have a snapshot of our Native American membership. And as of October 26th, we have 2,083 members who are who have noted that they are Native American in their Medicaid application, and they're with Molina. A lot of times when our Native American members go in to apply for Medicaid, sometimes they don't list that they are Native American. So that's one of the efforts that we're trying to educate on, is to ask our Medicaid enrollees to mark if they're Native American, so that we can include them in our population, and also to ensure that we get a better snapshot of our membership who is Native American. And so if you have Native American clients that you come across, please reiterate that they need to mark their tribal affiliate or their Native American status on their application, because a lot of times it may impact their enrollment. Like, for example, if they're subjected to any kind of copays or anything like that, marking Native American can assist with exempting them from that. And there are also other exemptions that apply for Native American members who are on government assistance programs. So we want to make sure that that's represented during their application process. And here you'll see our Native American population. There we have, as you see, it's up in the western part of New Mexico, in the McKinley County area, and also San Juan County. And then, as you can see, the Pueblo communities are represented as well here with the bubbles. And we have a lot of Pueblo communities represented in and around Albuquerque. And we also have our urban Indians too represented, who are off reservation living in Albuquerque for work or school, or just living off reservations. So that's noted here. And so you can kind of get a snapshot of where our Native American members reside in New Mexico. Okay. I want to throw in here too, excuse me, I'm losing my voice. The Native American Advisory Board that we have on a quarterly basis. And our next one is coming up on December 3rd. So you're welcome to RSVP to me if you want to attend that. And it's a great opportunity for you to learn more about what we offer for Molina Healthcare. And we are going to focus on different subjects during each advisory board meeting. And we will be discussing in December our population health program, which includes health equity and cultural competency programs. And we also will be talking about our value-added services updates. And we'll talk about our Native American Advisory Board charter. So that's another subject we'll be talking about. And this is an opportunity also for us to get valuable feedback from community as well and our providers. So this is an opportunity that we have to open up the floor to ask questions, to really help us to engage our community members and our community programs to ensure that we're providing the best service that we can for our Native American population. And this year, this quarter, in quarter 4, we're very proud to have been welcomed by Haku Health Center in Acoma, the Pueblo of Acoma. So we'll be there on December 3rd. And so if you're in the area, please come on by and reserve with me that you will be attending, and we'll welcome you. And we're providing lunch to attendees, and it'll also be virtual too, so you can call in. And once you RSVP, we provide you with the Teams meeting link to call in. And so that's happening December 3rd. And we also have our dates set for the upcoming year, 2026. And that's the flyer on the right of your screen. And again, I'll send all of these documents to Sam to distribute to you all for your files or for your sharing. And so that's what I wanted to say about our Native American Advisory Board. Are there any questions that you all have? I can't see the chat.
I currently don't see anything in the chat other than I let folks know that they will get all this information next week. And
Okay.
Gina says this is a very extensive program. Wendy mentioned, thank you, Sharon. Great work. Molina is currently hiring a senior communications engagement specialist for Albuquerque, and then added the link for that. And Shay said, thank you.
Okay, wonderful. Great, great, great. And I think I have additional resource contacts. There we go. So if you need additional information or you have specific questions, I put some resources here, internal resources at Molina. So please feel free to reach out to any of us. Rose Nelson is our VP for Healthcare Services and Behavioral Health. And then I have Sherry Roanhorse Aguilar, who is the director for our Office of Native American Affairs. And I have her phone number and her email in there. And then, of course, my contact information. I also listed Wendy Asante Esteban, who is our Director for Growth and Community Engagement, and also our Manager for Growth and Community Engagement at the Gallup Help Center. That's Josephine Barney. She also covers other tribal communities as well. And then we also have Marlene Driscoll, who is our manager for provider relations. So if you have questions for her, this is her contact information. And we have Jennifer Carlson, who is our senior representative for provider relations. And Jennifer covers a lot of the IHS Tribal 638 and Urban Indian facilities. So if you have any questions related to billing or claims, Jennifer can assist with that. Okay, so thank you, everybody. Thank you for listening to me, and thank you for having me come today to present our information to you. And I really look forward to working with you all. Please, if you ever want, if you have events or things going on and you'd like for us to know about it and share that information, just reach out to any of us, and we're willing to see if we can have representation. We can't be everywhere, but we can certainly work with you moving forward in the future. And I look forward to meeting more of you as the time goes by. So thank you so much for this opportunity.
Thank you so much for joining us today, for sharing all of that great information. And then for having those extra flyers that we can send out to everybody.
Yes, I'll send
and I'll
that to
share
you.
your contact information also. So
Okay.
thank you.
Thank
If
you.
anybody else needs anything from the Alliance, here's our contact information. Our next Health Council talk will be on the 21st about the adult checking program from the New Mexico Department of Health. And then one more reminder that on the 14th, Joseph will be presenting the federal funding and grants, which will have a lot of great key information about applications and also grant reporting at the end. So thank you to everybody who is here. Have a great rest of your Friday and weekend, and we'll see you again soon. Thank you.